but yeah.
Cohen's not playing.
Hi, Dorothy. Like I said, just a little bit.
Hello.
All right, listen, it's 5:31, so I know we have a quorum, so let's get this thing started, huh? Everyone, come on board. Mr. Zassoni.
Hello, I'm here.
Hello. All right, let's see all's here. Let's call to order the Democratic Caucus meeting of November 16th, 2020. Do a little roll call. Ms. Gorel? She's here someplace. I talked to her, so.
I just got to unmute myself. Present.
Okay, Ms. Red?
Present.
Mr. Girl?
Present.
Mr. Tassoni?
Present.
I see you. Mr. Neighbors? In any one or both of the fellers?
I'm here.
All right, Angela, I got you. Dan's not coming, I take it.
I can't speak for him. I don't know.
I think I can. He's not coming. Okay, we don't have any minutes. We don't have any speakers, do we, that we know of? All right. What we're going to do, first I'm going to go through this, and I would like to get the caucus chair and the vice chair voted on and get that out of the way. And can't vote, can't put on committees until after I have a meeting with Paul Arena, you know how we did last year. So is there any nominations for caucus chair?
Yes, I have one.
Bert, I think you were first.
I'll defer to Angie.
By Angie.
I like having you as my caucus chair, Joe, and I am going to nominate you to continue on. You are my nomination.
Thank you. Is there a second for that?
Second.
Mr. Girl, all in favor?
Aye.
Aye.
Any opposed? Well, we'll just go with that then. Thank you. I appreciate that. I want to have a discussion on the committees. I had a long talk with Angela, welcoming her to the committee, and we talked about different committees that are possible. Right now, I only have, if I move Mr. Neighbors at his request to public safety, I only have 2 positions open, and that's zoning and economic development. Ms. Fellers would like to be on the public safety too, but I can only make that move if somebody else wants to move off that. And I'm pretty sure, Angie, you're pretty solid on that committee, right?
Right.
And Ms. Red, do you have an opinion on that committee? Dorothy, you're muted. Can you? Dorothy?
Dorothy.
Well, I'm not going to get any answer out of Dorothy right now. So,
Yeah.
Well-
Can you hear me?
yes, Dorothy, thank you.
Okay. I'd like to stay on that committee. I've been on there for years, and I'd like to stay there, please.
Okay. Now, is there anybody else that got any other changes? I know, Mr. Tassoni, I got you taken care of. I have an understanding with, I think, Mr. Arena for you and Jaime to stay in your chairmanships. So I think that's solid. Is there any other committees outside of Angela who I have to work on? Is there any other people that want to make any changes to their committee assignments? No? Okay. All right. I would like to welcome Angela Fellers to this caucus. And Angela, I'm going to give you a couple minutes to introduce yourself and get acquainted with everybody.
I think I know everyone here. Is Tim not coming tonight?
Pardon me?
Is Mr. Neighbors here?
He is not here.
All right.
He
and
never
Ms-
contacted me, so I don't know what the circumstances are.
Okay. Well, I think I've met everyone here, but hi again. Thank you for welcoming me this evening prior to being sworn in. I appreciate your time and letting me attend. I ran on a platform of public safety, economic development, and fiscal responsibility. It is important to me that the committees that I am placed on are ones that match not only the expectations of my district, but also my personal skill set and my experience, which is why the committees that I asked to be on were what they were. So I'm hoping and looking forward to working with everyone and finding an appropriate committee placement that suits my skills and the needs of my district.
Thank you, Ms. Fellers. We will, I will continue to try to work on that for you. And even if it don't start out that way, you know, you never know down the road. Mr. Petita was a late change to a committee about 7 months into the year, wasn't he, Bert, if I remember right? Yeah.
Yes. Not
So,
only that, we have Republicans coming in too, and perhaps there's some committees they don't want to be on, like safety or economic development, and then Angela can be put into those positions.
yeah,
There's always, we have
just
to
for the
remember
record,
new Republicans coming in.
hold on, Angie. Let me follow up on just what you just said now while I'm thinking about it. I spoke to Paul Arena about that very issue. And I tried to get another spot on public safety, but the problem is if I get another Democrat, we're going to have the majority in the party, and that is not going to fly with them. And I didn't expect it would, and I don't think it would fly with me on the other side. So if I was the majority party, but we're going to keep working on it. And go ahead, Angie, finish your statement.
Oh, that's all I was going to say, because I know we have other new people coming in too. So, and then a lot of times they don't like the position, you know, what's there, and we can do some changing back and forth. In fact, sometimes they get on these committees and they decide to change. They don't want to be on that committee. So we have another month to look at this, and perhaps, Angela, some of these things will open up for you.
And we have one other thing too to consider. I had a talk with Paul Arena about the P&P committee, whether it's going to stay on as a full committee or something else, because that go back to the person to the operations committee, and that's still somewhat up in the air of how that's going to handle. So that could make a big change on committee assignments too, because there's a number of people on that committee, and then there's going to be some ad hoc committee system too that I think we're going to work on. If we don't have the personal policy, we'll just go to an ad hoc committee. Mr. Tassoni.
Thank you, Joe. And just like I say, I'm not sure if you're aware of it, Angela. Myself, over the years, fell victim to it, and appointment to the committees falls on the majority, at least the Republicans holding the majority of the votes. I've seen it to where it's the 11th hour. I mean, and the votes hold to where they dictate, you know, if it was a party lines vote as to who's on what committee. So I've seen it to where, you know, various people have wanted to be on certain committees and it was just voted down. So, like I say, you just got to kind of get a little time in and find your place and all that. And as people shuffle and move around, but I think that whoever controls the votes on the board controls the committee appointments as well.
All right. That is very true. I got to say, we were fortunate. I think I was fortunate that in the last, when we did the last election, that I had a good relationship with Mr. Boomer. And I was able to get a couple of chairman spots, which I am eternally grateful for, and is the last thing I want to take a chance on losing. And you guys know how hard we fought for those. So I don't want, and I think Mr. Arena's a good guy too. And but we do, it is still political, so we'll have to deal with that. But I'm going to tell you, Ms. Fellers, I'm going to work on it. I'm not going to stop working on it. I get what you're saying, and I'm going to try to get people what they want on what committees and where they're the best. And even if it don't happen right away, I'm not going to stop working on it. That I promise you.
It's my understanding I can attend committee meetings even if I'm not a member of the committee.
You can go to the committees. What we used to do before this last couple of years is you'd go in, sit in the kind of the peanut gallery, and it was up to the chairman of that committee whether you could speak to that committee. Last year or so, it's been pretty much people sit up at the table and, raise their hand like anybody else for a question. And be honest with you, they've pretty much been calling on whoever's there to speak. I don't know if that'll continue. We have a couple new things going on. We have Mr. Arena, who's the new Republican Caucus chair, so he may not want to do that. I don't know if he does or not. I would imagine he probably wouldn't mind, but I don't know for sure. And we have a new chairman. He may or may not want to go with that. So I can't speak for Mr. What is it? So I can't speak for the chairman either. So I don't want to say, but I think you definitely can attend the meeting. There's no doubt about that. Just whether they'll let you speak up and sit at the table is the question. But they have in the last couple of years.
Thank you.
And you certainly can say, and you can ask your former partner, you can speak at the county board meetings. My man, he did a lot of speaking at the board meetings, so you have a lot of input there too.
Yeah.
And everybody speaks on every subject in that.
Yeah, and I think that you'll find that my predecessor and I are not necessarily interchangeable, that we have significantly differing views and approaches to things.
And that's okay. That's good. But I didn't mean to be putting Dan down about that. He just had a lot of information to give. So, and a lot of it was good information. He just wasn't a lawyer. But he thought he was. But anyway,
appreciate the joke.
no, don't put Dan down. He did a lot of good things. The last thing I want to discuss is because I know the Republicans are discussing it. Chairman Haney's disaster proclamation. I'm reading it over. Have anybody had a chance to read it too, or look over?
No.
Yes.
It's basically, I can't find anything. I disagree. It's pretty, and Angela, maybe you, since you read it, you can probably correct me, or at least it sounds like it's pretty much things that we were already told to do, and he just said, hey, we need to do them. Am I correct?
Yes, and that's my understanding too. So the disaster proclamation is a necessary proclamation by the county in order for us to have access to state and federal COVID relief funds. Without the disaster declaration, we're at risk for not getting relief funds from other sources, grants, things that are passed at the state and federal level. So it is necessary. It's my understanding that there was a previous disaster proclamation that was passed. It was then extended by the county board. The county board did not bring it up for vote for extension, and it lapsed, whether that was an oversight or something that we didn't think we needed at the time. And I strongly encourage everyone to continue the emergency declaration and that we keep it going.
And go ahead, Angela.
I have to go on with Angela. I didn't know that's what you were referring to. Yes, I did read it. And we have to have that type of backing, because this county does not have the funds to support what's going on and the additional monies that we are using. This is one of the most important proclamations that there is, and there's no sense in any of us voting that down. We need it.
Yes.
And this isn't going to end today. This is going to continue on. And why we are doing it on a month-to-month basis, I don't understand, because it's not coming from the county's money. It's federal and state money, and actually it's all federal money because the federal money sends it to the state. And even if we were to have some other type of disaster, like maybe we have 20 feet of snow this winter and the river's flowing over, that money's important to us because we also use it for flooding and anything that is a disaster. We have to keep that. Thank you.
Go ahead, Mr. Tassoni.
Thank you, Joe. And I guess I got a couple of different questions, whoever can answer them. Yeah, I guess the disaster relief thing, I don't know if it's just, if it has to be on a 30-day period and each 30 days we re-vote it to continue it. And then I was wondering if anybody could tell me, maybe Angie or somebody that knew about the health department, does that enable Dr. Martell to have some, a little bit more of some teeth as far as some things that she wants to enforce? Because I remember she had some other authority back when too.
Let's ask Dr. Martell. I think she's online from what I can see.
I am. I'm sorry. I'm going to have to, I'm going to make sure I hit the Republican caucus tonight too. So just so you know, if I jump off.
Just, and Angela, I'm sorry, I don't know if you heard my full comment or question.
Mhm.
Does this executive order extension and then the board approving it give you a little more teeth in as far as what things that you need to do?
Okay, let me come back and say, no, it does not really give me more teeth. Okay, so this is simply because, just so everyone's aware, last week, and I was clear and shared with all of you, we did put in a request for what we call additional bed sets through the Illinois Emergency Management Association, ventilators, and we made a staffing request to support our hospitals. And to Ms. Beller's statement, it really is so that we can access resources and capabilities within federal and state assets and be able to begin that process of reimbursement. Most counties did not, they left theirs open and extended through the pandemic. I hate to say it, versus a month-to-month renewal. And so I think that, you know, I guess there was concern that we would misspend funds or what, you know, I understand that the county chose this way, but I think it was time to reenact it because we were requesting resources. And most recently now we've have a request for what we call portable morgue services as well, because our morgue is spilling.
Well, and what can I, back when like I say, I guess for the lack of appropriate words, we removed some of your authority based on whatever it was. What can this board do that would help you have some more authority or enforcement as far as things that you can't do right now as far as restaurant and bar service?
So that was an amendment to our food code that allowed us to suspend food permits as in relation to the pandemic. So for instance, if we were issuing a closure order or their failure to follow the executive order, we could also suspend their food permit. Under our current ordinance, that is not, I cannot do that. So we'd have to modify or put in an order regarding our food code permit. But right now, this is just really the declaration of an emergency so that we can continue to access funds and resources at the federal and state levels. But there's two parts. I mean, there's two pieces we can go through. And so what we put forward though is just this part. And then if we want to consider and continue on that, then I will have Charlotte and the group and the state's attorney draw up what we did the last time, which was to make a temporary modification to our food code in our ordinance.
Okay, well, I'd just like to add that, I mean, if it comes to that, and I'm just guessing that might go through a public safety committee, but if it comes to that and you need some more authority to what you're doing for whatever reason, I would be apt to support that.
I appreciate that. We can continue on. We are continuing to enforce. I think all of you know that. But the numbers are not getting better. It's not having the effect that we'd like it to have.
And may I interrupt again?
Go ahead, Angie.
One reason we need this to go on for at least another 8 months. We are only going into a peak right now, but that peak might continue to rise. We can't depend on ourselves to come back every month and renew it. This has to be permanent for at least 6 to 8 months until we get by as much as we can. It doesn't mean we're going to waste that money. It means we're going to use it only for the necessity that we have to have. And so doing a month to month, you see what's happened. The infection continues to rise, and now we're caught with no monies to back up for what we have going on right now, this emergency, this crisis. So it needs to be a longer term than 1 month. We need to vote on it for a longer period of time.
Mhm.
I have a question for Dr. Martell.
Go ahead, Dorothy.
How does the sheriff department play into this?
Well, okay, this is the emergency powers. And again, it's the declaration of the emergency that allows us to access additional resources and support. And so that's different than the enforcement piece of it. So the sheriff under the public health code is technically an agent of the state that's required to enforce executive orders related to the pandemic. That's a different discussion.
Okay.
The enforcement part, it's been extremely important, obviously, or the lack thereof has been extremely important. Um, But I think that what I think we really have to get, why I'm going to make sure I'm getting on the Republican, because there was a lot of concern about that this gave the chairman too many authority and powers. And I want to come back to the idea is that, well, we need this in order to be able to access and get reimbursement for the monies that are being put out for some of these supplies and resources. And so without that declaration, we may become ineligible for reimbursement for it. And, there's no, we're not paying into it, but we certainly at this point are having to activate some resources that are outside the scope and capability of what the county normally has access to or provides. And we need to be prepared and ready to be able to submit against it with the emergency declaration. And as we're one of the few counties that did not keep theirs open-ended through the end of the pandemic. So that means I have to come back every time. And so I'm thoughtful about coming back, not just coming back just because it is, but we are in a situation now where we do need to be able to access critical resources.
Okay, thank you. One other question. The hospitals, I don't know if they're running short, but now will resources come through the health department for the hospitals, or are they on their own?
Well, Ms. Red, the question about the hospital and resources. So in this case scenario, they made a request through our emergency operations center in the health department for what we call bed sets, meaning
Okay.
actual physical beds to be moved into the hospital locations. They were turning their conference rooms and their holding areas into hospital beds. And so at that point, we put in what's called an emergency request through the Illinois Emergency Management Association. It goes up to the federal, which are federal assets. And then that was delivered on Friday. And then the hospitals were allocated the additional beds. Same thing with ventilators. So they're not on their own, and they work with us. And we have at least a 3-time-a-week call right now as to what resources they may need or assistance they might have. And they requested additional staffing support. We put that request in for federal asset. We have not, as you would guess, staffing's a little more challenging given the nature of the whole entire nation, but that is the role that we play in an emergency situation with our ESDA coordinator through Winnebago County. That's through the contract you have with the City of Rockford Fire, and both our Winnebago County ESDA coordinator, Mallory Ron, is there as well. So we then coordinate and consolidate our resource request and get with the hospitals as much as we can get what they need.
Okay, great. Because just to make this comment, my husband spent 36 hours in the emergency room because they did not have a bed this past Tuesday.
The Thursday before the election, I had a small stroke and was not admitted into Mercy. I was actually admitted to a love seat in a waiting area because they didn't have any beds.
Right.
Yeah.
Well, they need the help.
No, and again, I think if you had an opportunity on Friday, they kind of, Swedes has used almost every capacity space. OSF has pulled in beds and gotten some supplies out of Peoria as well. But all of our hospital systems, including Mercy, have surged, what we call implemented their surge.
Yes.
To expand. We are understanding ED weights are high. And they are functioning as one system for admission of COVID. So if you are being transported just for COVID, they will kind of, I'm going to say spread the love, but work as a system to see who's got capacity within their emergency departments. And oftentimes you'll hear about people being boarded in the emergency department. So that's the additional need for beds, because fire department can't take you off their rig until they can get you into a bed. So again, really working through that, but that was why I requested the emergency declaration so that we could continue to pursue that. And again, I'm willing to come back as much as we need to come back if there's a trust issue, but we needed to get this done so that we were not left without the resources.
So Dr. Martell, is there capacity at the Rockton campus that Mercy has pulled services out of? Are they using every room? Do we have the ability to expand into that facility if we needed to?
So Rockton Avenue, question is, the problem, the challenge they have is we don't have staffing, which was that's why they have pulled from Rockton Avenue, because they can many of these systems have also been impacted by the fact that the infection rate is high. There's staff that are infected and can't come into work, right?
Mhm.
So the challenge is I can maybe one nursing setup can do 3 or 4 patients on Riverside, but I can't split them 2 and 2, right?
Right.
Because and that's the challenge that they're faced with, which is why we put in a request for what they call the DMAT, which is the Disaster Medical Assistance Team, to provide medical staffing that we could deploy to those locations, including the Rockton Avenue.
I got a question for Dr. Martell, if I may, Mr.
Go
Hoffman.
ahead, Jaime.
Thank you. Dr. Martell, under the current, are we still able to get additional funding for the PPE through the CARES Act and stuff like that for reimbursement? Or is that kind of dried up and we're still potentially waiting for additional funding from the federal level and state level?
And the question was about, are we still eligible for CARES money? And yes, I know that both our financial officer along with me, Molly Tiernoni, have been submitting all of our claims through that and submitting those, and we are getting reimbursement. But again, the challenge is some of these assets where we do not necessarily, in order to access some of the disaster supplies, you have to have a disaster in hand, right? I mean, I hate to say it kind of in that some of these things like the bed sets, we don't pay for, we request them as an asset for us to borrow. Other
Gotcha.
things like PPE, we have to pay for. That is true. So we are, constantly at this point, we have to, if we're really asking for all these additional resources as a county, as a leadership perspective, I think we need to come out and say we're in a situation where this is very much an emergency situation, and that we need support from outside entities to support us. And I apologize because I don't want to miss the other group, because the last time I missed them, and they're a group that's really challenged with this declaration.
Yes.
Sounds great. Thank you, Dr. Martell.
Yes, thank you, Dr. Martell.
Sorry.
I had one more question, Dr. Martell, really quickly. Do we lose out on opportunities if we don't have an ongoing emergency declaration? Does the anticipation of a 30-day renewal, does that make it so that we're not first in line for funds, or do we get popped to the back of the line?
I don't think that there's necessarily a hierarchy that you get popped to the back of the line, but it makes you may be ineligible for funds if you don't have one that's active in place. Because they will ask you when you submit the request, do you have a disaster declaration in place?
So having it in place is proactive and gives us the ability to move immediately rather than having to go through another step.
That's correct.
Okay, thanks.
Thank
Well,
you
thank
all.
you, Dr.
Stay safe.
Martell.
Thank you, Dr. Martell.
One other thing I wanted to get to, did Mr. DeSoni leave?
No, I just left the room for a second. I'm back.
Okay, I don't know, I omitted saying that I would like Mr. DeSoni to stay on as my caucus chair. Does anybody have any objections to that?
I
Okay.
mean, you're vice chair. You cracked up at that time. Yeah,
Talk about Mr. DeSoni.
100% for that.
Go ahead, Angie, I didn't hear you.
I am 100% for that
Okay.
too.
All right. Well, you still want to be there, right, Mr. DeSoni?
Yes, I'd appreciate that, Joe. And if I could just say a couple words,
Please.
just to give Angela some backdate info and all that. Myself, Angela, have been on the board approaching 13 years now. And like I say, for the first 8 years or so, I mean, it was a Republican run everything, committees, chairmanships, votes, and things of that nature. And in the last probably 4 or 5 years, it's gotten a lot more of everybody's getting along a lot better. It's not so much around the party lines unless it's, something that's real hardcore. Myself, I was on the Public Works Committee, which deals with all of the highway department stuff. And I was a member of that committee for quite a long time. And I became chairman of that committee, not without some kickback. It took a little struggle and it took a couple of times. And now I'm there, but there was a good period of 8-10 years where no Democrats were chairs of committees. And I'm fortunate to be on that for now myself. And I would appreciate continuing on being Joe's vice chair. And let's just, keep the ball rolling.
Yeah, and yeah, it was a tough battle. I mean, and both of the two chairs we have are by far the most qualified people on the board to be in those positions. So I'm going to give it to Mr. Boomer for that one. He was the first Republican that was open to doing that. So for that, I'll always be grateful to Mr. Boomer. And Angela, I am not going to stop working on your deal. I know what you want. I'm not going to quit. I don't quit.
It's, it's just, there's been a move away in our community, specifically where the term public safety has been co-opted as meaning only law enforcement. And in the middle of a public safety health crisis, and in the middle of civil unrest, we really need to make sure that we're fighting hard to keep that definition expanded. If people are afraid to leave their homes because they may get sick, or if they're afraid to leave their homes because there may be crime, it's the same fear. And I just think that it's really crucial that is carried into that room with some emphasis.
Well, and I'm going to tell you, you get between, you don't get much more putting her voice out there than Miss Goral. I'm going to tell you that right now. So you got some good people there. I'm not saying that we have enough people there, but I have as many as I can get there now. But I'm not going to stop working on it. And I want to see, one thing I really want to see is if we continue with the PNP committee as a full committee, or if that goes away. That's going to change a lot of things. I think if that is not a full committee going into this next session. So let's see where that goes. Again, Angela, I'm not giving up on it. I got quite a few committees, so there might be a committee that I step down on that gives you an opening, because I think I don't know how many I have anymore. So let's look at it at that point. I'm not going to give up on you. These guys will pretty much tell you I fight for my caucus, and I try to do stuff. So I would appreciate your patience, and I will promise you I will keep working on it. Does anybody else have anything else to add? I want to welcome Angela again to the committee, and hopefully we get stronger and we have another strong voice to keep things going. So welcome, Angela and Mr. Stoney.
Thank you, Joe. Joe, have you heard any conversation about who might be Mike Zintek's replacement on Public Works?
I think it's probably going to be Lindmark.
Okay, yeah, I would think so. I mean, the same district and same.
I mean, I haven't heard any changes that they made because I did talk to Paul yesterday or today. I don't remember which, but there are some changes, but there's not many right now. And by the way, I told Angela to tell you guys, I did try to get a fourth Democrat on public safety, but even as my relationship with Paul couldn't even get through that one. So that would have gave us the majority, and he wasn't going for that one, and I don't blame him. So anyway, we'll work on it, but we'll see what happens.
Hey, Joe, what do you know about how the swearing in or whatever festivities are going to happen?
Well, that I haven't heard anything about that yet. Boy, I don't know if they're Zoom that. They'll probably Zoom that, is my guess.
Has anybody talked to you about it, Angela?
I know that it's on, excuse me, that it's on the 7th. I had a conversation with Chairman-elect Shirelli, and when we discussed it, I suggested possibly having it at Memorial Hall outside on the stairs so that we could still have family there. And that was taken as an idea, but I don't know where the location will be. Ms. Mullins called me today as well and said that she would be sending over an email with more information.
Yeah, I guess we'll see when we see, right? And I think it probably depends on how well we're doing on COVID right then too. So,
And it's going to depend on the weather.
And in Memorial Hall, I guarantee you there would be no people there other than people sworn in, because that was always packed. Go ahead, Dave.
Just sometimes I get crazy thoughts, they only mean something to me or not. But you know, if it was Miss Gummow and all that, maybe they did like a personal thing at each's individual home or place they wanted to be with their close-knit family or small group of friends and went to individual places versus everybody trying to be in one area.
Yeah, I had suggested staggering the swearing in so that we did people in half-hour, 45-minute increments so that people could come in and come out as was necessary. But that's a great idea too. I like that.
Well, I hope something works out to make
Yeah.
it something meaningful.
Yeah, I'm open to whatever. So we'll see.
For
I'm sure-
those of us who are there by ourselves, we can all just Zoom at one time and take our pledge and whatever. For those of you who have all your family there, you might want to do it as a group, like David suggested, in a special place.
Yeah, we'll, go ahead, Dave.
All right, thank you, Joe. Just one last thing, and then I'm pretty much done. Public Works, no report. We're meeting tomorrow night on a couple things.
Okay. All right. Anybody got anything else? Otherwise, I'm calling it a night. And ask,
Zoning has nothing going either.
huh?
Zoning has nothing going.
And we don't have, I mean, I thought maybe the county board meeting we're having there, but that's just about discussing the disaster proclamation is from what I understand. So,
Yeah, it's just a special board meeting for that. So no other committee meetings.
so
We
yeah.
might have something, excuse me, for economic development, because we're having a meeting Wednesday night.
Okay. All right. Well, we're probably going to discuss that next Monday.
Right.
If we have, well, we'll discuss that the Monday before we have next board. So, like I said, this meeting isn't about that. So,
Angela,
Yes?
one of the things I have always enjoyed, and even if I wasn't on the committee, I'd like to go into the committee meetings so I knew what was going on. And as long as I've been on that board, I still, in fact, with the Zoom, it's even easier because we back up one right after another so you can see it and participate. Otherwise, you need to know what nights they are and where they're meeting, and that, sometimes we're spread out all over. But I have found that to be the most beneficial thing to me is to know. The only one I don't go to is to Sony's. I mean, he knows what he's doing, and so do people. And I don't know if he's getting a 20-ton truck or a 1-ton truck. I don't know the difference. But the rest I find to be very important and very interesting.
Yeah, I will, attend any committee meetings that I'm assigned to, and then other committee meetings I'll attend as I'm able with COVID and childcare.
well, that's a good thing. I think that's the good thing about this though, Zoom. You can watch the kids and go. So,
Yeah.
Yeah.
So,
I Zoom with them. I'll go on and I'll speak if I have to, but it's all done on Zoom and it's easier.
yeah, I don't know if we're going to get back live for a long time. It doesn't look like.
A long time before we get back.
Yeah, I
Yeah.
saw a statistic yesterday that was released by the mayor of Chicago's office that 1 in 18 people in Cook County is currently has an active COVID infection.
Yeah.
So
It's just, it's not good. It's not good at
Yes,
all.
and even though I've had it, and my family's all had it, in 3 months we can get it back again. So it just kind of recycles itself until we get it under control. And it's not going to be under control for another, 8 months probably. And then it won't be under control. It'll be a start. So it has to be cautious for all of us.
So on that, and have motion to adjourn.
Don't move.
The girl, Mr. DeSoni, all in favor?
Aye.
Aye.
All right, you guys have a good
Good
evening.
night, everybody. Go Bears.
Aye.
go Bears.
Yes, go Bears. Go Bears. Go Bears.
Welcome aboard. Good night.
Half